New research shows that a vaccine aimed at preventing the painful shingles virus may also lower the risk of dementia. Dementia affects more than 55 million people worldwide, and those numbers are expected to grow over the next 20 years. Meantime, although 1 in 3 adults will get shingles, many are still opting out of the vaccine. Dr. Richard Ferguson joined me to talk about the effectiveness of the vaccine and what causes the virus.
Many people may not remember, but it's from the varicella. It's herpes zoster that's reactivated, the same virus that causes chickenpox. So after someone recovers from chickenpox, the virus stays dormant in our nerve cells in our body. And then years later, it can wake up and cause shingles. And so if some people remember, when you had chickenpox, you got sort of these little blisters that would kind of raise on your skin. In chickenpox would tend to be very itchy. It's often an itchy thing that children would have. You put on a calamine lotion, other barrier ointments, and something to cool your skin, and then it goes away. Well, it can often go away for 45, 50 years before it reactivates out of those nerves. Then it becomes very painful. You then get these small blistered lesions that will give burning, tingling, and often sometimes a stabbing pain even before the painful rash will occur. And what's unique about our shingles rash is it's almost like a band-like rash with these fluid-filled blisters, usually on one side of the body or the face. So it goes along a dermatome. So the nerves on our body are aligned with particular areas as they exit our spinal cord. So you can have something that'll be at the lumbar L4 region or L3 region, referring to spinal nerve roots exiting and then branching out at particular areas of our spine. So it can be in our face, it can get in our eyes, it can actually get in our ear. Wherever you pretty much have skin and nerves, shingles can show up there.
Who is at most risk of getting shingles? I know there are vaccines for older people who against shingles, but first of all, who's most at risk?
Most at risk is anyone 50 years and older and immunocompromised. But you can get it almost at any age. So if you're an immunocompromised adult and I've seen shingles come out and reactivate in someone as young as 20. I've seen it in someone in their early 30s. And sometimes it was a result of them just having significant illness, prolonged illness for several weeks, and their immune system was just weakened. And then people were just odd. They're like, wait a minute, I had chickenpox 15 years ago. Why am I having this show up now? And we're like, actually, this is shingles, especially when it comes out in that band-like dermatome being on one side of the body versus another. But yes, it's 1 in 3 adults will get shingles. That's about how common it is. And I think a lot of people don't understand that. And then, of course, the risk rises after 50, just because naturally with age, our immune system starts to weaken.
Why are people over 50 asked or recommended to get vaccines? Why is it so important for that group?
Just because it's most important, because studies have shown that that's when natural immune compromisation will start to occur. So it's in those because I'm trying to think of the best way to clearly state this. If it's going to occur, it's going to be in those far greater than 50 and older. And it's far less likely to happen, particularly with the introduction of the chickenpox or varicella vaccine at younger ages, where kids aren't even getting chickenpox anymore. So you've got vaccine-mediated immunity, and then you've had folks that are older that had chickenpox where there was no varicella vaccination around. But I guess to simply answer the question, our immune system ages, gets weaker over 50, and so the incidence, much higher likelihood, if you're over the age of 60, 70, that you will get shingles not only once, but possibly more than once. So that's why we often advocate strongly that when you hit the age of 50, you get the Shingrix vaccine.
So this is a two-parter. How come a two-part vaccine?
So many vaccines are that way, especially there are pediatric vaccines, adult vaccines that are like this. It's been studied for often decades when developing these vaccines on how best to teach the immune system. So you have to often, the first dose is to prime it, where you get partial immunity. maybe about 40 to 50%. Then you wait 2 to 6 months, and then you get the second dose. This is a non-live 2-dose series with Shingrix, and most common side effects is short arm. You get a sore arm, maybe a little bit of fatigue, but it's spread apart because if you can't really give 2 doses shorter or really one large dose because you're not giving enough time to space out for your body's immune system to learn. It's kind of, I compare it as, do you want to try to cram all of, say, an undergrad learning inorganic chemistry in one semester, or do you want to spread it out over 2 semesters for them to properly retain? We want our body to retain how to recognize and stop the reactivation.
How effective is the vaccine?
Oh, it's quite effective. The clinical trials, when Shingrix was done, it is about 83% effectiveness overall for up to 20 years. So that's pretty good.
Yeah. Do you find most people actually go ahead and get the vaccines?
I would have to say it's variable. My own mother, who's 73, didn't get the vaccine until this year. And part of it is, I think, peer influence. People thinking, why do I need that? But all it takes is you to see a friend or a colleague and see how painful it is. I mean, it can be painful enough that it leads to you going to the ER and being hospitalized, particularly if it's in a certain area of your body. You know, if it's around your mouth, if it's around your eyes, one can get blinded from untreated zoster reactivating on your body. But it can be very painful for weeks at a time. But I think some people say they're just under the impression of, well, I already had chicken pox. It may not, it's the kind of that thought of, it's not going to happen to me. But given this is given that this is a vaccine that's highly covered by Medicare and most insurance plans, why would you not want to stop yourself from having a prolonged, painful lesions on your body that will often just come out of nowhere? I've seen people where shingles is a result of it got triggered because of stress to their body after getting a sunburn. So why would you want to ruin your summer vacation? Let's say you didn't protect your skin as well as you should. You got a little bit of a first or second degree sunburn, and then 2 days later, you now have a really painful rash that's developed that's unrelated to the sunburn. But unfortunately, you triggered a stressful event that allowed that immunity that was already living there to stop the the zoster virus from reactivating.
All right. Any final thoughts on shingles?
I would just say, please get it. It's a painful rash that can lead to pain, something called post-herpetic neuralgia, and vision loss. So let's do our part, get the 2-part dose, go out and get it today. It's available at your local pharmacy. And just remember, 1 in 3 adults in their lives will get shingles.
Dr. Richard Ferguson is the head of the Black Physicians of Utah and our partner here on Health Matters on Midday.